At a panel discussion recently here in Washington, experts on security, climate change and reproductive health focused on the famine crisis in Somalia. One of the key topics discussed was lessons learned during the region's last famine nearly 20 years ago. VOA's Carolyn has more.
The current population of Somalia is 9 million, and it has the 8th highest birth rate in the world with an average family size of 7 children. The population strains food resources and economic security. Experts met in Washington to focus on Somalia, where millions of women lack access to family planning. Mary Robinson, former president of Ireland and chair of the Aspen Institute's Global Leaders Council for Reproductive Health, says the famine in the Horn of Africa is linked to high reproductive rates driven by high child mortality.
There are families who are trying to cope with very large family size, which is very understandable if your children are going to die. So how do we deal with this? Education of the girls and women and access to reasonable health care. Then you find that the family size comes down very dramatically.
The UN's Walid Abdelkarim works on Somalia security issues. He notes the impact of climate change on food security.
There is no longer moisture, the cycle of rain doesn't happen. There are places that didn't have rain in Somalia's green belt, if you wish, for the last 3 years. And that is one of the main reasons. But this has also had an impact even in places like Mogadishu. You were talking earlier about the importance of dealing with the environment in a relief setting. I completely agree with this. The area of Mogadishu and Afgoy has become so deprived of trees that the refugees now have to pay for the tree under which they will spend the day.
Mary Robinson says the drought cannot be ignored.
What I feel very much is the Horn of Africa is not responsible for climate change. The 50 poorest countries in the world contribute less than 1% of greenhouse gas emissions. We're the ones who are actually, in our lifestyle, fossil fuel based in Europe, in the United States, and other advanced countries. We're profiting from an overuse of the budget of carbon, and we're causing more climate shocks to the Horn of Africa.
Family planning is central to any discussion of climate change and security, according to Geoff Dabelko of the Woodrow Wilson Center.
That we don't have the luxury of treating them as consecutive issues. So first we get peace, and then we have elections, and then we can start talking about what have traditionally been put as second-tier, lower priority issues, such as maternal mortality, population, and providing reproductive health services, providing a long-term perspective on sustainability that is so critical to some of these questions of long-term nutrition, as well as getting the economy started, and education.
The failure to learn from the famine in Somalia in 1992 is a global problem, according to Robinson.
If we can empower the women of Somalia, both in Nairobi and those already in Somalia, we will have done a lot to make real progress and not be, as we are, I think, a bit guilty of the fact that a famine has been declared and that thousands of children are dying of hunger in the 21st century. It is not acceptable.
Somalia is not at a point where it can take care of itself. Ignoring it in any way at this point in time would only make it deteriorate. Not ignoring it has a huge chance of succeeding going forward in spite of the presence of hard-headed people like Al-Shabaab. Don't let this game changer go without changing the game.
The Global Leaders Council for Reproductive Health is asking world leaders to double their investment from $3 to $6 billion to provide women in poor countries with essential family planning services. Carolyn, VOA News.